afternoon, everyone. I'll start my session with a very simple story. Walking down the hallways of our university and our faculty, I realized line and lines of students gathering around the elevator. Now, these lines created a very crowdedness and a very noisy atmosphere in the hallways. Then I asked myself, why aren't our students using the stairs? Even though we know that the stairs from ground floor to the first floor is only 25 stairs. Why aren't our students making the healthy decisions? Now, moving forward, we know that climbing stairs is a very effective and very efficient physical activity. It reduces the risk of cardiovascular diseases by 20%. It reduces the risk of mortality by around 24%. It gives a very positive vibe. It's an energy boost. Then why aren't our students taking the healthy decisions and taking the stairs? Then the idea stayed in my mind. For the next coming days, it expanded in my mind. I realized that during our breaks, all of our students are eating sweets, energy drink, fast food, oily food, and no one, not even a single student, I didn't see them eating any fruit or vegetables. Now, most of our students have medical backgrounds. They know about diseases. They know about risk factors. They know about recommendations. We are well aware of that. It's recommended that we take 5 servings of fruit and vegetable per day. We have the knowledge, but why aren't we taking it and why aren't we applying it in our daily lives? Actually, studies in Iraq say that not only in Iraq, but in the whole Middle East, fruit consumption is very, very low. It's very, very inadequate. We have the information, but we don't apply it. So in the coming days, me and my team decided to do something. We decided to apply. We had to do something about this, actually. We tried to do nudge theory. What's a nudge theory? A nudge theory is a theory that says that if we change the environment, if we put cues, if we guide people, then they can do the healthy decisions. They can make better decisions without enforcement, without taking their freedom away, without taking their autonomy away. So the nudge theory became very popular in many sectors and in many fields after the work of Thaler and Sunstein. It says that we usually think that we make our decisions rationally. We make hundreds of decisions per day, right? Do we think about every decision that we do? We actually don't. We make our decisions based on what's easy, based on what's visible, what's in our eye level, and based on what other people around us are doing, so we follow. So we tried to bring that, even though those ideas, I said, those social experiments have been conducted in many countries globally. We tried to bring this nudge theory and do 2 social experiments within our university to see that if we can use nudge and that we can make an environment, we can change in the environment so that our students make healthier decisions. So in our first experiment, we put tables and then we put fruits as whole around the entrance. There was a modest increase in consumption of fruit. There was around 105 fruits consumed in that day. Then for the second day, we did our interventions. We did our nudges. What did we do? We changed the seminar halls, the screens into fruits. We had posters all around the university campus of fruits. And then we also created fruit cups. What are fruit cups? If you guys know, in Kurdish culture and also in many Middle Eastern cultures as well, when we're all tired and we go home in the evening, when our parents are sitting with us in front of the TV, parents, usually moms and dads, bring in fruit, they wash the fruit, they peel the fruit, and they cut it and give it to us very ready, and we consume it. Me and my siblings, that's the only way we eat fruit. So we thought, why don't we bring that idea and also apply it within our social experiment? What did we do? We cleaned the fruit, we cut the fruit, we prepared the fruit in 2 fruit cups so that it's easy to grab, it's interesting, and it grabs attentions of students. And also the student doesn't have to think whether I have to take a banana or a mandarin or an apple. We just made a mixture of all of them and put them inside the fruit cups. Then what's very interesting, within the first few hours, we saw 2.5 times more increase in consumption of fruit. That's 157% more increase in fruits. Now, what I want to say that we didn't enforce eating fruit. We didn't do any educational campaigns. We didn't dictate anything on anyone. We didn't tell the students to eat fruit. We didn't ban sugar. We didn't close the cafeteria. We only changed the environment. We only made the easier option the healthy option. Then moving forward, we also tried to do something about the footsteps and the climbing the stairs as well. So we created a footpath, a colorful footpath, from the entrance towards the stairs, not towards the elevator. Among that, we opened the doors permanently, and also we put some motivational stickers on the stairs climbing, how many calories someone will lose with each step. And we attached the schedule in a colorful manner, announcement of the faculty on the door, so that students are nudged to go through through the staircase and not the elevators. Now, again, we observed the CCTV cameras and we saw that after putting our nudge, after changing the environment, actually staircase users increased by 10%. Okay? Now, what's more interesting than that, we also observed that once one person inside a group chooses a healthy decision, once one person inside the group chose the staircase, everyone else followed. Once one person inside the group of friends chose the healthy fruit cup, everyone within the group also followed the same. This is what we call social proof as well. Now, in public health and as humans as well, we usually wait for the perfect conditions to happen. We usually dream of big budgets, big policy change, big systematic change, which is also very nice and acceptable. But then these social experiments also show us that doing some simple nudges, doing some simple, small, easy things, changing in the environment can also have very big positive impacts as well. We started with very small budgets, some approvals, some stickers, some cups, some fruits, and then we did some hours of activity with our team, and we immediately our short-term outcomes. Our short-term outcomes was an immediate rise in fruit consumption, an immediate rise in staircase users. What we are hoping for is that these experiments becomes a habit, so that people choose the healthy decisions as a habit, not as enforcement. And also, we don't have to wait for hours and days and weeks and months for perfect conditions. We can create those nudges at any place, at any time, whether it's at your homes, whether it's at schools, whether it's at university level. We can change our environment into better environments so that we have a better health outcomes. Our impact for these social nudges our aim is that so that we have reduced cardiovascular risk, reduced in diabetes levels, and overall reduced mortality rates. Now, what my team and I learned from these experiments is that we usually tend to underestimate how our environment shapes our decisions and shapes our habit forming. We started this session asking why our younger generations are not taking healthy decisions, whereas the question should be, why can't we change the environment so that the healthy decision is more visible, it's more easy, and it's more accessible? That's what we do in public health. We try to improve the health outcomes of populations and communities, and sometimes in fun and active ways as well. Thank you very much.